A little after 9 o'clock. Good morning, everyone. I'm Scott Nicklin, along with Megan Cullen.
Good morning.
Good morning. Here we go again, right?
Yeah, I know. This is awesome.
Well, it's important and awesome.
Yeah. I'm just excited to have, something to get up and go to in the morning.
Well, I'm glad we can provide that for you.
When we used to get up and go to work.
That's right. That's true. But welcome, everyone. This is KSJE's local community information program for coronavirus, COVID-19, where we share what's been going on the last 24 hours. We're doing this live Monday through Thursday, beginning at 9 a.m. And then we will rebroadcast this audio, by the way, tonight at 5 p.m. on the radio station, KSJE. Right now we're streaming on YouTube and Facebook, but we'll be on the radio later on today.
Right. That's right. I'm excited about that. We're just hitting all sorts of airwaves.
We are.
The internets,
and we have been working in conjunction with another local public radio station, which is KNMI, Vertical Radio, and they're also airing this program as well. And we need to find out when they're airing it. I don't know when they're airing it. We don't know the
time, but
we don't know. But we've heard that they're airing it.
We've heard rumors. Speaking of rumors,
and we let them air it, so that's
Scott,
good. Yes.
Are you pulling up the FEMA? Okay. All right.
But we're going to talk about rumors because there's a rumor.
He had one job.
Control. I have it written down.
Okay.
I have it written down, the website. Because yesterday we were talking a little bit about misinformation, and in fact, Dr. Schmidt, the superintendent of schools from Farmington, was talking with me yesterday morning on my show, and he was saying that he's concerned about potential scams and things like that as more people are going online, maybe even students to do their work.
Yeah.
They could be getting these scammy emails that are trying to get them to click on certain things. So
scummy scammers. That's
right. That's right. So there is a rumor control website that was shared on this program yesterday by Nicole Brown. Thank you, Nicole. And it's FEMA.gov/coronavirus-rumor-control.
There it is.
That's it.
So, yeah. And I didn't really, I was like, rumor control, what does that mean? But yes, but that's great. That's that's a nice, reliable source to debunk.
I agree.
It's like the Snopes of disaster.
That's true. Exactly right. So that's how we're starting today, to let folks know about that resource. And we'll call it up here throughout the show and let folks kind of see what it's all about. But we do have someone on the phone.
Oh, already? Okay,
already.
All right,
so let's see who is joining us here on the phone. Good morning. You're on KSJE.
Scott Nicklin, Rev. This is Tom Yost.
Tom Yost.
Tom Yost.
Welcome, Tom.
How are you guys today?
We are well. I think. I can speak for Megan.
Yeah, no, we're well.
She made it here on time, so that's a win.
That's a win.
How are you?
I'm doing well.
Good. Good. So you were here to share some information about maybe staying active while still trying to be physically distant from each other in these times?
Well, yes. At the First Tee, we are sending participants emails and videos with activities that are golf-related and life skill-related to help with sort of the schooling at home job that parents have overtaken now that the schools have been sort of postponed. So we're just trying to do our part to make the day go by a little bit faster and a little bit easier for everybody that's cooped up together, staring at each other, going, when is this going to end?
Right.
Yes. I think about that is like my morning and evening prayer. When is this going to end? It's a lament. So, Tom, I've seen some of these videos here, and I think Scott's pulling them up. And what I'm most impressed with so far is A, that you still have like the golf pants and golf polo on, even in quarantine, and B, the juggling video. That was yesterday. You want to talk about that?
Yeah, well, first off, the main two things that I got commented on were my choice of colors, especially my shorts.
There he is.
Salmon.
Yeah.
Salmon. Salmon shorts. And my clown comment with the juggling. In fact, some of my friends who watched the video, in fact, told me that I was a clown. Privately, but that's okay.
And now very publicly, so good.
Right. Yeah. Interesting.
Yeah, I mean, these videos are reaching all across America, which both excites and terrifies me.
Okay, there you go. So we're looking right now about your video about aim, roll, and stop. That's what we're seeing right now on the screen, Tom?
Correct. Yes.
Yeah.
There is there's 2 videos out, and there'll be more posted today. But the first one is called Save the Toys, which is basically getting on the carpet with a putter and a ball and putting toys as targets. And every time you hit one, you save one. You can play by yourself, or you can play against your family.
Gotcha.
And friends. If I can't endorse that, but I'm sure some people are having friends over.
Well, just not more than 5. You're good.
Yeah. Right.
Yeah.
Right.
And those socks you're wearing, Tom Yost, are those specific socks we need to wear if we're going to try this at home?
So you guys once again are jumping on and piling on.
No, I'm just asking a question. I'm asking a professional. I don't know. I've never played in my living room
We have
golf.
some good co-host
putting.
chemistry, Tom. Wait, Tom, we need to cover real quick why we should watch your golf videos. Like, what is your relevance to the game of golf, and why should we pay attention?
What is my relevance? Well, I'm a PGA golf professional.
Yeah.
Yeah, that's a huge relevance. Yeah.
That's a huge relevance, but also I'm the program director of the first tee of San Juan County, New Mexico.
There you go.
So basically we teach life skills and character values through the game of golf. So what we're still trying to do and incorporate in each one of those videos is something golf related, but also something, life skill related. Being honest, if you don't hit a toy, you don't get to pick the toy up. With the juggling, we're talking about perseverance, because juggling, whether you're throwing balls up in the air with your hands or you're bouncing a ball off the club, is extremely difficult, and it's easy to give up.
Right.
When it comes to that. So, and also we talked about goal setting. How many can you get? How many do you want to get? Just reaching goals and passing goals and setting new goals and that sort of thing. So, the relevance is, we're still trying to incorporate our life skill and character value message, but I'm trying to do activities at home for our participants that are fun and engaging. We'll keep them active for a little while anyway until they grow tired of that and move on to the next activity. And I know parents are struggling right now trying to keep the activities lined up at home, and we would prefer they wouldn't be involving phones or television sets. So
For sure.
Right. But good advice. And, of course, these videos we're watching, Tom Yost, are available from the first tee of San Juan County Facebook page, correct? That's how folks can find them as well.
So we have 3 avenues. We put them on Facebook. We've put them on our Instagram page. And I also email them out. I have about 500 to 600 participant and family emails that I send out. But what I want to encourage is if a family finds my videos, to share it. I mean, I don't want this to just stay community. I would like these to be shared, to whomever, with whomever, nationwide. So, we're all going through this together. So the more that we can help out each
That's
other,
right.
I think the better.
That's right. Well, we appreciate just having something to do at home, Tom. So, amongst talking to all these physicians and healthcare workers, it's nice to talk to somebody that's provided a way to stay connected and stay active in our shelter-in-place moment here collectively. So, thank you, Tom. We have another another caller, right, Scott?
We do,
okay,
indeed.
Cool.
So,
cool.
Tom, thank you very much. We're going to let you go.
Thank you, guys. Hey,
All right.
one last thing real quick.
Yeah, sure.
I want to see videos of both of you juggling
Oh,
posted on our Facebook page.
All right,
See how
I'm
you
gonna
guys
try.
are doing.
okay.
I'm going to try.
All right.
I'll try. I can't guarantee Scott Micklin will try.
We'll see. I don't know. But and just to be clear, Tom Yost, we are talking about putting in the house, not practicing our drives in the house.
Yeah, no, driving probably wouldn't be good anywhere.
Okay.
Just based on what could possibly break.
Yeah.
Both in your house and houses adjacent to yours. So,
Yeah.
we're going to keep it simple and probably not work on big full swings. So,
Okay. And there's his
more to come, though.
There's
More
his
to come.
juggling.
Stay tuned.
Okay.
Yeah, thank you so much, Tom.
Thanks, Tom.
Thank you.
Very good. Tom Yost, everyone, first tee of San Juan County. Thank you very much for calling in. And we do have another caller on the line that we'll go to right now. Good morning. You're on KSJE.
Good morning. This is Dr. Philpott calling from San Juan Regional Medical Center.
Yes, Dr.
Good morning.
Philpott, thank you. Dr. Aaron Philpott, you are the chair of the Infection Control Committee at San Juan Regional Medical Center, so we do appreciate you taking a minute of your day to talk with us about how things are going, and hopefully you can give us a little bit of an update, if you wouldn't mind.
Yeah, of course. Thanks for having me. So we have been working really hard here at San Juan Regional Medical Center for a few weeks now in preparation for the possibility of COVID-19 arriving in our community. We suspect we do have community spread at this time, though the state hasn't identified us officially as a county with community spread. I think given our kind of unique regional situation, we have additional data, from our surrounding states that suggests that there probably are cases in our community of COVID-19. So we as a hospital are starting to assess each patient that we see as a possible COVID-19 case, depending on symptoms, which largely include influenza-like illness, so fever, cough, shortness of breath, muscle aches. There's been some suggestion that GI symptoms also are a component of this illness, so those tied in as well. So we've made some shifts in our hospital in anticipation of this. We've divided our emergency department to appropriately address these different symptoms and assess for the possibility of COVID-19, and then have divided our hospital into different floors as well to make sure we really are vigilant in keeping our healthcare workers safe and preventing any spread of this virus within the hospital.
Very good. And Dr. Philpott, I just wanted to explain a bit about that community spread that you mentioned, because a lot of the earliest cases were maybe travel related, so folks had maybe traveled outside of the county and were coming back, and that's maybe how they became ill. But now with this community spread possibility, it's just an ill person coming into contact with a healthy person, and then they're now becoming ill. Is that kind of the idea behind community spread?
Yes, that's exactly right, Scott.
Okay. Thank you. Just wanted to make sure everyone understood what that means, which is why it's so important, I guess, to stay home and stay separate and do all this physical distancing that we have been talking about, correct?
That's exactly right. And I think now is the time that it's more important than ever as we're seeing this virus take off in different parts around the country, and as we try and control it here as well.
Right. Megan?
Yeah. Yes. Thank you, Scott. And this is, I don't presume to know that you would have maybe a clear and firm answer on this, but is there any, now that this is like spreading around our community specifically, when we're talking about timetable, like a best case, worst case scenario when it comes to how long we're going to have to physically distance, which again, I know that you probably don't have a very clear answer on that, but I wanted to throw it out there.
What do you think, Doc?
Yeah, good question, Megan. I don't think we have a firm answer on that yet. I think, as far as the physical distancing or the social distancing, the intent, just to explain the intent of that, because I think it's so important for our community to understand. I'm sure many people have heard this concept about flattening the curve. And essentially, what that means is we're not going to be able to control the spread of this virus. We are inevitably going to get some spread. And the question is how much and how fast. And the idea of social or physical distancing is to slow the spread as to not allow it to happen at such a rate that our hospital becomes overwhelmed by ill people. And that is why it's so important for every single individual in the community to take this seriously and flatten that curve, so to speak, meaning instead of having a big spike of patients needing medical care coming into the hospital, we have kind of a flatter curve or a more controlled, slow need for hospitalization, intensive care admissions, ventilator use, and all those things that are associated with more severe illness.
Right.
So as far as how long people need to do this, we don't know yet. I think we're going to get a good sense over the next couple of weeks to see what the presence is in our community and be able to have more information as time goes on.
I see. And Dr. Philpott, do you have any idea where we are on the curve in San Juan County? Are we still on an upward trend? Have we yet to peak? Is there any way to predict kind of where we fall on the curves that we're trying to flatten?
Yeah. So far we have one positive case in our hospital. We have 7 total in San Juan County as of yesterday. I haven't heard any updates today. We have a number of people in our hospital that are currently what we call patients under investigation, or people who have undergone COVID-19 testing and their test results are pending. I would say, there's a whole range of clinical suspicion for these various patients as to whether or not they have it. But again, for healthcare worker safety, we're being very vigilant with our personal protective equipment. So we are very early in this curve. And I think we'll again get a clearer idea over the next 1 to 2 weeks as far as what we might see as far as COVID cases and the trajectory that things might take.
Great. Yeah, that's a super helpful answer. So it's nice to know that there's still hope for getting ahead of that curve, especially as we watch, what's going on in Italy.
In other places, that's right.
In Italy, when you're talking about countries that are close to us, just in affluence and medical professionals.
Right,
what
and
we
even
have to
other
offer.
states.
And even other states, of
we
course.
Talk about that as well. And Dr. Philpott, what I get from what you just told us was that since we've got 7 or 8 cases confirmed here in San Juan County, you've got 1 patient hospitalized, is what I understood you saying. So it sounds like most of these cases then folks have been able to maybe go home and self-isolate and then recover or get on the road to recovery. Is that what you're saying?
Yeah,
at least so far.
As far as the numbers go, 80% don't require hospitalization from what we're seeing out of other countries, and I think generally here in our country too so far. So that 20% that requires hospitalization, there is 20% that generally requires hospitalization. And then of those, a smaller proportion requires the intensive care unit. So we do, as I said, we have a number of patients in the hospital currently with tests pending. So, but I think largely we have been seeing some people with influenza-like illness or symptoms of possible COVID-19, and they've been able to go home. And really, at this point in time, those that don't need medical attention, that's what we recommend. Just you hunker down at home if you're ill, and you take scrupulous measures to self-isolate, especially when you're ill, and to even take measures at home to prevent transmission to your family, which some of them include, just really good hand washing, even sleeping in a different room, using a different bathroom, are some of the things folks who can do when they're ill at home with other family members still.
That's great advice, Dr. Philpott. And I was mentioning to Megan Cullip earlier this morning about a video I'd seen on Facebook from another medical professional in, I think, the state of Michigan, talking about how to maybe even try to disinfect things that you're bringing into your home, even from the grocery store, or package deliveries and things like that. I imagine that is something, maybe not your area of direct expertise, but it's something maybe we could wipe those things down with some Lysol wipes or something to try to be extra cautious. Is that some good advice?
Yeah, I think at this point in time, this novel, which is this new coronavirus, there's much that we don't know. So I think any precautionary measures without, generating anxiety or going completely overboard are within reason. And I think that sounds like one of them. We do know there's studies that this virus is a sticky virus, meaning it can live on surfaces. So that's absolutely right. Wiping down high-touch surfaces is a big component as far as controlling this virus. And then I think you could extrapolate it to even say what you're suggesting, just as a precautionary measure. You could leave things out for a couple of days before using them to allow, the virus to, if it was stuck to that package, to die. This is not scientific, but or wiping them down as you suggested. And I think, again, there's measures we can take. We don't know if they'll help, but I certainly think at this point in time doing things like that could be useful.
Great. And I have one more kind of question of curiosity just to test this line, because I've been throwing it around and now I finally have an infection expert to ask it to. Part of what we're talking about is not just overwhelming the hospital with these cases, right? It's just that other accidents and, injuries and illnesses aren't going to stop just because there's this viral spread, and those accidents and illnesses might also require intensive care, right?
Yeah, that's exactly right, Megan, and that is something that we have been very focused on here, and that's just continuity of our other services and making sure that we can serve our community kind of based on our hospital's mission to address those different things like traumas and car accidents and heart attacks. And I'd like to say in that same vein, with social distancing, people still need to take care of themselves. You still need to get your medications from the pharmacy. You still need to eat healthy, not drink to excess. Go outside and exercise, maybe by yourself or at least 6 feet from someone else you're walking with, but really still focus on your health, and that can help sort of flatten this curve too, so to speak, in another way, as you mentioned. By not for these other issues.
Thank you. Thank you so much for that. Thanks for all talk about a wealth of information we've received, Scott.
No, we appreciate you, Dr. Philpott, very much so. And I know you're very busy. How are you and the rest of them filling up? I mean, we know that you're being asked to do these for amazing tasks and things for our community, and so our thoughts are with all of you who are serving the community in these long days. But can you let us know how things are going there? Is staffing still good? How are things going?
Yeah. I think overall things are going really well. I think morale is still good. I think everyone has a healthy sort of sense of anxiety, I guess you could say. That's probably not healthy, but
concern.
Yeah, concern. Thank you. That's a better word. But I think I have been consistently impressed since the onset of the possibility of this epidemic arriving here, of our teamwork here and the support from the senior leadership, the support from the nurses and the RTs and everyone, just really collaborating and working together. And I would also say I've been so impressed with the medical communities around the country that are working in this very collegial way to share information and kind of address this as a full team. And it's been really impressive. So I think, people are nervous, people are concerned, and we have new changes every day. There's new studies published nearly every day, and there's a lot to keep up with. But I think overall people are really taking it in stride and stepping up and pitching in. And I think we really feel the support of the community with all the efforts and the donations and the efforts to address PPE in many different ways, shapes, and forms. So I think overall really good so far.
That's good to hear.
That's great to hear.
And that leads us to the next line of questions we wanted to ask you about, Dr. Philpott, which is some of the needs of the hospital. And we've heard about that PPE, that personal protective equipment and masks. And I know there's groups of folks that are maybe sewing masks for maybe not necessarily your medical professionals, but even your patients to maybe wear if they're coming to the emergency department or things like that. How are the things that you have stocked there at the hospital? What are some of the things that you might be able to use if folks could find them to donate them?
Yeah, so we, I think as an institution, are doing okay. I think anticipating the sustained epidemic is something very important as we consider our future personal protective equipment needs. So we're trying to be very thoughtful about that. As far as, so I think at this time we've recently made a lot of adjustments kind of to reflect or mirror similar large medical centers across the country. We're taking measures to help protect our staff from all patients coming in, just because the kind of some unknown transmissibility components of this virus. So all patients coming into the ED will be given a mask to wear. And as far as what the community is doing or could do, the cloth mask, there's a big effort to make cloth masks, and I think that's much appreciated. Donations of, surgical masks from various offices are appreciated, and I believe our Facebook page has instructions on how that can be done. And then we're getting a lot of really incredible support with people with different skill sets, making different equipment, and we're yet to determine how that will all come into play, but I think we're thinking we're open and thinking of ways to use these resources.
Well, that's great to hear. So I think I speak for Scott that don't be a stranger. Call us anytime, Monday through Thursday. Okay. We would love to take your call and hear more up-to-date information, anything that you get.
Okay.
Yes,
Sounds
Doctor.
good.
Thank you very much for your time. And again, please send our thanks and gratitude to all of your colleagues there at San Juan Regional Medical Center.
I will. Thank you so much. We appreciate it.
You're very welcome. That is Dr. Erin Philpott. She is the chair of the Infection Control Committee at San Juan Regional Medical Center, joining us on our local information program, COVID-19. I'm Scott Micklin, along with Megan Cullett.
Yes,
And,
I love it. I love it when we get to
information.
hear from. Yeah, I love it when we get to hear from the docs. It's like I have all these questions rolling around my head, and then I have like the monopoly on asking them all the time.
Right. Well,
How great is
we had a comment on Facebook saying they appreciated her information, and it makes folks feel a little better about maybe the outcomes here, which we are in these uncertain times.
Exactly. I mean, it's always great to hear from an expert who also says, like, hey, guys, I get it. It's uncertain. There are things we don't know, and that's why we're asking for some precautions and an abundance of caution, because that term novel always comes to mind when talking about this, I think for good reason. As the doc was saying, novel implies that there are so many things about this strand that they are working around the clock to study and figure out and learn more about. And when you think about what that would be like, you have this invisible threat that is continuing to barrel down at you, and it's almost like a race against the clock to figure out more and more information about it. So that's just pretty stunning to me to think about. So
Indeed. So, very good. Thank you, folks, for watching us. Again, the comments, we appreciate it, and we're glad to be able to put this program together for the community, by the way. And please spread the word. Again, this is on Facebook. It is also on YouTube. And for folks, if you have maybe elderly folks in your family who aren't on social media, they can be listening to the radio tonight at 5 p.m., 5:06 p.m. specifically, 90.9 FM, to hear the audio part of this program. So again, everything that Dr. Philpott said will be repeated tonight on the radio at 90.9 FM at 5 p.m.
Ish.
5:06.
It's double the news, double the fun.
That's right. There you are, everyone.
There you are, everyone. Well, then while we're on the hospital topic, we want to make sure that we remind people that today is the day. That's the big blood drive that they're doing over there, 6 a.m. to 6 p.m. You can find more info on bloodhero.com, but also, so that's at San Juan Regional Medical Center until 6 p.m. today, and so we wanted to remind you guys that is happening.
Exactly.
So.
We've heard a lot about the need for blood in the country these days.
Yes. So, we're at like 40% of, they have 60% left to fill, basically, is what I've been reading.
Is that what it is? Okay.
So that's, so
Gotcha.
do that.
All right. There you go, everyone. Yeah. And then, as we always do at the top of, we do usually at the top of the show, but I want to do it now, is check in on the latest stats in the news that we've been compiling since yesterday's show.
Oh, look, 12 more cases. There you go.
And again, we have, that's right, we have a running spot on our website, again, KSJE.com, under news for COVID-19 coronavirus information. So the latest cases from the state are 112. San Juan County now we have 8. The doctor thought it was 7, but I think there was one more that came in, and she was probably busy doing doctoring things.
Yeah.
So I
Did
understand.
you not hear the woman, Scott?
That she
is.
That's okay.
She's discovered as the sticky virus. Even in the past week, they discovered that. So
That's right.
anyway,
But if you
impressive.
scroll down, you can see kind of the latest information. And again, this is from the state. This was yesterday. We have a new case, a male in his 30s here in San Juan County. So again, a lot of the cases that have come into San Juan County have been in more younger people. I think there's maybe one guy in his 50s. But the rest have always been maybe in their 30s and 40s.
I kept saying this. Yeah, we're not immune. And
No.
again, going back to the novel thing, it's from what I've been reading, it's any disease and illness is going to hit your elderly and immunosuppressed, and oftentimes even small children worse. But that doesn't mean that people my age should not follow the exact same precautions, and it doesn't mean that they're seeing more and more people in ICUs that are that age. So,
Right. Or younger. So,
yeah,
again.
or younger. Thanks, Scott.
You're welcome. Just keeping it real.
Just kidding. Yeah, you are no longer the youngest generation, Megan.
I'm
Yes.
sorry, but there
Yeah.
you go.
Yeah.
But the other stories I wanted to pass along too is Navajo Nation. We've updated the numbers there, and there's now 69 cases across the Navajo Nation. That does include 7 here in San Juan County that are considered on the Navajo Nation part of the county, and then there are several in Navajo County, Arizona, and Apache County and Coconino County, and then of course 4 in McKinley County in New Mexico and 1 in Cibola County in New Mexico for the Navajo Nation. Just to our north, La Plata County, reporting now 3 more positive cases of COVID-19. And again, that's in La Plata County in the Durango area. And so that was the other news story that came in since our show yesterday.
Yep, they keep rolling in.
They do. And, again, we're not surprised. But again, we want to try to limit these, as the doctor was saying, flatten the curve. And so we want to maybe see, if we can see 1 or 2 a day or 0 a day, not 50 a day, that's what we want.
That would be ideal.
Yes.
But going back to the testing thing, again, they also keep pressing. Don't just decide one day that you want to swing by the tents. That's not a thing that they want. You have to have very specific symptoms that seem to indicate a possibility, not just I feel hot today or I have body aches today or
scratchy
whatever.
Throat, maybe I should go.
No.
Not good.
The shortness of breath is what they keep pressing for.
And again, the hospital will do these external assessment sites. I believe they're doing them 3 times a week. The next one's tomorrow.
Yes, and it's the parking lot right across from the emergency room / main entrance. You'll see the white tents. It's pretty obvious. You see a bunch of orange hazmats walking around, and
Do you know where to go?
It's a pretty good indicator.
But they're saying if you don't have these specific symptoms,
stay home.
To call, or if you still feel sick, call your primary care physician. And but don't just show up at their office, because they're taking precautions too.
Exactly.
So they want you to call first, explain your symptoms, and then they can let you know what else to do. There's also a statewide hotline to also get more information about this as well. If you don't have a primary care physician, there's a statewide hotline that
if
you
you've
can
been
call.
dragging your feet on that, like me, for instance.
Megan.
Yeah. Sorry, guys.
See?
I know. Don't be like me, guys.
That's right.
Yeah.
Don't do that. But before we go, because I think we're running out of things to talk about, unless someone wants to call in, and we have the number on the screen, everyone. So if you want to call and let us know how you are dealing with things, if you're playing golf in your living room, let us know.
For
just
example,
like Tom Yost did.
Yeah, I want to hear. I want to hear more about that. I want to hear more ways that people are, sort of passing the time, so to speak, while we're in this weird, bizarro land of quarantine.
Right.
I mean, I've heard a lot of interesting sort of plugs for increased productivity, which I like to caution against, because I'm like, just because, for example, Shakespeare wrote King Lear during the plague while all the theaters were shut down. That doesn't mean you're expected to reach similar levels of productivity or anything even near it. That in a lot of ways we should not presume to know what would be best for each individual during this time. But that being said, it would be really interesting to hear from listeners. What are you doing? Are you watching Parks and Rec for the 17th time, or reading? Are you becoming like a book person or something, and you haven't been previously? It would just be really interesting to know those things. I, for one, am not going to do any activity that incites more frustration in me. So I'm not going to be sewing the masks, for example.
Okay.
Not on my list, Scott.
Okay. Well,
Not on
that's
my
all
list.
right.
Yeah.
We'll do that. So interesting. We mentioned this rumor control website earlier. I want to show that to our audience that we have it ready to go. This is what it looks like. That is the FEMA rumor control website. So again, if you hear a rumor or you want to check out a rumor, like anyone would ever post anything false on Facebook, I can't imagine. But I've heard that sometimes it happens. Yes.
Shocked, I say.
I know.
Yeah.
But that would be where you would go to this rumor control. And I'm going to see if I got the number or the address to come up on the screen. There it is, FEMA.gov/coronavirus-rumor-control. Look at that. I was typing
That's a
furiously
lot.
over here.
That's a long URL.
It is.
But I'm assuming if you type
If you go to FEMA.gov, I bet you can find it from there too.
perhaps, or just type it into Google and see what comes up.
FEMA rumor control.
That's the thing.
Or the search engine of your choice.
Yeah, that's true. Yes.
Okay.
Yes, you're right. Yeah, any search engine of any choice
There you
of
go.
your choice.
But that's what it looks like, everybody. There you are.
There you go.
Okay.
So, is it time?
I think we're about done
So
with
is it
information
positive
today.
time?
I would love
or
something positive
waxing
today.
Poetic time.
Something
Something.
affirmative.
Just something.
Affirming.
Okay.
Please.
Affirmative.
Just
Affirmative.
yes.
Well, this is also a helpful piece of information, and I also just think an example of ways in which people are growing more and more creative and figuring out how to stay connected, even if it's obviously 100% less than ideal. And I really don't want people to get used to this, right? I don't want that to happen because I'm not a huge fan of doing my work remotely
Yeah,
or like on
right.
a whatever
Phone.
video. Yeah. So anyway, I'm not keen on like having to set up a studio or something like this one. But recovery groups, which are very, very important, obviously, for people who are in substance abuse recovery or mental health recovery.
Right.
Groups like AA or Narcotics Anonymous or any of Gamblers Anonymous, any of those, a lot of those have moved online, including just this week. Unfortunately, a lot of our sites in town that were designed and created to be a safe space for that kind of stuff have had to shut their doors, but they have moved online through various online platforms. Your favorite of online platforms, which only you can decide, listener. So if that is something that you are in need of or looking for, I can only speak to sort of one avenue, but AA.org has a whole list of online meetings. So if you're seeking that, then you can check that out. And hopefully people can still get their support that they need. So
There you go.
Yeah.
I think that's a good advice. And
Yeah.
a message on our Facebook page. Again, thank you for that comment. Again, it should be emphasized that no one is immune. You're exactly right about that. We were talking about that. The point I think that we were making earlier was that not everyone is being hospitalized who has come down with a positive case
Right.
of COVID-19.
yeah, Dr. Philpott said 20% require hospitalization.
Right.
Roughly.
And so in the majority of cases, the idea is if you do even get infected, in the majority of cases, 80%, you could probably go home, self-quarantine yourself at home, and get better.
That's what
Is
we
what
heard from
she's
the
saying.
doctor.
That's
Yeah.
right. But there you go. But you're right. Everyone is at risk, and everyone needs to take precautions. And the other thing is that, our elderly are maybe most at risk, and so the idea, whereas it may not make us very sick, and we can recover at home, if we spread it to someone who's elderly, that's a very different story, and you don't want to do that.
That's right.
That's why we're physically distancing ourselves.
Yeah, we are.
And that's the whole
Week
point.
2.
There you go. So that's
Persevere.
how it is. Exactly.
Yeah.
Well, Megan, thank you for being here
Hey,
yet again.
super fun.
We
I
are
love
here again. We're going to do this again next week, everyone. We'll do it as long as we need to do it, Monday through Thursday. We won't do the show tomorrow, but we'll be sharing all this information. If there's new stuff that comes in, we'll be updating all those stories on KSJE.com. So you can always use that as a resource as well, and check out FEMA.gov for that rumor control site.
That's right. And, on a super light note and a similar though different note, there's still Radio Free Saturday mornings.
Well, thanks for that plug.
Yeah.
Right.
Of course.
That's when you
I
put
wonder
on
why
your
I would
disc
plug
jockey hat.
That. Yes, that's when I remove news journalist hat and put on disc jockey hat. Radio Free Saturday mornings, 9 to 11 a.m.
And it may be almost a corona-free virus zone. I don't know if you talk about it. I don't think you do.
I do not talk
it's all
about
music, right?
Yeah, it's all music.
Yeah.
I purposefully avoid talking about it. It's all music and the stories behind the songs and the stories behind those who write the songs. And so
It is not your usual KSJE musical fare like
No.
jazz or classical. Megan goes deep, deep, deep into the archives. here at KSJE.
The deep dives.
Yes.
It is 100% true to say you have no idea what you're going to hear that morning.
That is very true. I can attest to that. I have no idea what you're going to play for us
This
every
is
week.
every
Some weeks I'm a
Saturday
little
morning.
worried as the general manager, but
Exactly.
that's what we signed her up. We signed up for this.
That's right. That's
Yeah.
right. So,
So.
listen.
9 a.m. to 11 a.m. on Saturday mornings, everybody. And also, we've been talking a lot here at the college about checking in on some of our workers who are working from home and things like that. And that's, again, I think always worth repeating. If you have someone that works in your organization who is working from home and maybe they are isolated or they're individual, they don't have family members, it might be a good thing to call them up and see how they're doing.
Yeah, I'm going to go so
reach
far
out.
as to say it's a good thing.
Yeah.
Take
do
the
that.
might out. Do that. Yeah. This is a directive.
Okay.
Yeah.
It would be a good idea to do that.
Yeah.
And just check and see. And just reach out and say hello.
Yeah.
And see how things are going. I think that's a great idea. And one final note before we go. If you are tired of the news, I want to remind you that KSJE is news free from 6 p.m. to 6 a.m. every day.
Every day.
Every day. So we air BBC News 6 a.m. to 6 p.m. Monday through Friday, so you can get informed of what's going on in the world, of course. But after 6 p.m., it's just music.
It's right. It's jazz and classical.
And all weekend,
right?
it's music.
And all weekend,
Saturday and
it's,
Sunday.
Yeah, deep tracks.
So we think that's maybe an important break for many of us.
I do.
So there you are. All right. Thanks for joining us, everyone. We'll be back Monday, Megan and Scott, on this important community information show from KSJE. So stay safe, stay healthy, and have a good Thursday, everyone.